right, administering medicines to my patient here. First step, I'm going to prepare everything outside of the room at the Pyxis or at the MAR. First step I'm going to do is check my patient care plan. I'm going to compare my patient care plan to the Pyxis or the MAR, make sure all the medications match as far as what I'm supposed to be giving, make sure there's no contraindications for the medicines with my specific patient, make sure that there's no allergies involved. Patient shows no allergies, so I'll confirm that with him as well. And then also making sure none of the meds are expired as I'm collecting them and gathering them for all my supplies here. So got all my supplies for my IVs that I'm going to hook up. I have all my supplies for my injections I'm going to give. And then I have supplies for my couple of pills that I'm going to administer to my patient as well. So I'll gather everything. Like I said, I've checked everything against the Pyxis, against the patient care plan. Everything matches up, no allergies, contraindications. Expiration dates are good. So into the patient's room. Hi sir, how are we doing? Here to administer your morning medications to you, 9 o'clock meds. And we're just gonna get everything prepared here. I'll provide privacy as I came into the room here, shutting the door or the curtain. My supplies, I'll introduce myself. My name's Nick Sullivan. I'm gonna be your RN today, be taking care of you. I'll ID the patient, 2 forms of ID, full name and date of birth. Also at this time, I will scan his one of his many wristbands here to ensure that it is him, and then again match up with all my medications. I'll scan all of the medications as well, make sure everything matches. Sir, is there any allergies that you're aware that you have? No? Great, okay. To your medicines here, no allergies, so we're good. Again, I'll check the expiration dates now that I'm in the room and I've scanned everything, good to go, and contraindications once again, so I'll sit there. So everything seems to be safe to administer to the patient. I've ID'd the patient, introduced myself, provide privacy. Now I'll explain everything to the patient thoroughly. So today, sir, we're going to give, so we have 6 medications to give to you. I have 2 that are going to be given through the IV, some Kevzol and some normal saline that's going to be administered through the IVs. Your Kevzol is for pneumonia or an infection. There's some minor side effects that could come along with that. GI, your stomach could be upset. Just let me know if you're having any stomach issues, any pain there, and we'll see what we can do. The normal saline will be administered with the Kevzol in the IV. No side effects with the normal saline. That's just to help it kind of run through the body correctly, and for hydration as well. Then we're going to administer a couple injections to you. We have heparin sodium and vitamin B12. Your heparin sodium is for blood clots. Make sure you don't get any blood clots. With that, you could see some bruising, some bleeding. Again, we'll monitor that, and obviously just let me know if you see any abnormal bruising or anything. That's going to be giving, I can give you a couple different options. The patient did say he wanted it in his abdomen though. We're going to make sure to stay 2 inches away from the belly button, and just away from any other scar tissue, bruising, open sites. We'll find a good site, a good clean site on the abdomen to give that. And then the vitamin B12 is just for a deficiency. Some side effects with that, just maybe soreness at the injection site. We're going to actually give that intramuscular. We're going to find the acromion process, I believe that's the right word. And then we're going to go 2 fingers down from that, and then we'll be kind of right on the good spot there for intramuscular injection. May have a little soreness, like I said, at the site from that. And then after the injections, the only 2 that we have left are the couple pills that we're going to give to the patient. We have atenolol, which is for hypertension. Could cause some dizziness or lightheadedness. Just make sure to be careful when you're changing positions, standing up, sitting, laying down, from a laying down position or sitting position. Could spur that dizziness or some unbalance, from that medication. Again, just let me know, and change positions slowly because of that. And then finally, the acetaminophen or the Tylenol is going to be administered, because when we took your vital signs this morning, you did have a little temperature. It was like 101.5, I believe, if I'm looking at my chart. So we're gonna go ahead and give that to you just to get that temperature down. No, no side effects, with the Tylenol there. So pretty normal stuff. So I'll give him some options as far as how he wants to take his medications. He did want to take his pills first. So I'll administer those. Then we'll do the injections, and then we'll hook up the IV sites last to administer the Kevzol and normal saline. So first things first, I will go ahead and put on my gloves since I have not yet. Explained everything to the patient thoroughly. He had no questions, and he did advise he wanted to move forward, and that he's okay taking his medications here today. He understands everything. Only thing I did not go over maybe was the dosages that I'm going to give to the patient. So, sir, for your Kevzol, we're going to administer about 500 milligrams of the Kevzol, and that will be administered over about a 30-minute period, and that's going to be one of your IV bags here. We're going to give 75 milliliters an hour of the normal saline, and that's going to be administered through the IV as well. 1,500 units of your heparin sodium. That's going to be, like I said, the injection that we're going to give in the lower abdomen. Vitamin B12, we're going to give 1,000 micrograms. That's going to be the injection we give here intermuscularly on the arm. The atenolol, and that was for your hypertension. We're going to give 100 milligrams, and then the acetaminophen or the Tylenol for the fever. We're going to administer 650 milligrams. Just so you're aware of the dosages, the routes. The time that we're giving these is approximately 9 o'clock for your 9 o'clock morning meds. I have the correct patient, I've determined that, and patient, like I said, is good to go moving forward. So, first things, we're going to administer the pills first. I have my pill cup here, and as I'm preparing these, I will simply open them. They are two different colors, so I can tell them apart. I have a yellowish and a white pill. My Tylenol here, 650 milligrams, and then my atenolol, 100 milligrams. Patient said he was okay taking these at once. I got some water for him. Just to make everything easier here, I'll go ahead and raise him a bed before I start anything with the patient. Get him on the same level as myself. Make my job easier and his job easier. Since he is going to be swallowing some pills, I'm going to also raise him up to at least 30 degrees. We're going to go a little further, maybe semi-Fowlers, just so he's in a good position here to swallow. So I'll turn him here towards me. Go ahead and administer the pills to him, give him some water. He took those down just fine. No complications, so I will get rid of my stuff here in my trash. Pills are down. Next, we're going to do the injections. So I got my vials here. First, we're going to administer the heparin sodium. Check my chart here. Heparin sodium, we're going to do 1,500 units. I show here that I'm giving, that the heparin comes in 1,000 units per milliliter. So that means I'm going to give 1.5 milliliters, and that will equal my 1,500 units that I need to give to the patient. So I have my syringes here. I'll go ahead and put my blunt tip needle on first. We'll grab an alcohol swab and swab off the top of my heparin. Make sure that's nice and clean. Let that dry. I'll rip that for about 15 seconds or so. Let that dry. And then I'm going to draw back my 1.5 milliliters of air. Take my cap off. Put the air in. And then I'll draw back my 1.5 milliliters here. Got that there. Make sure we got no air bubbles. Good to go there. Actually, before I did that, I would have scooped my cap back on to be safe. Then I can check the air bubbles. Good to go there. Take my blunt tip needle off. Dispose of that in the sharps. Go ahead and administer the correct needle for my subcutaneous, sub-Q for my heparin. So I'll go ahead and put the correct tip on here. Already drew it up. I'll get a new alcohol swab, and again, patient did want this in the abdomen. Stay 2 inches away from the belly button. I'll go ahead and clean the site for about 15 seconds. Allow that to dry. Then when that is dry, carefully take my tip off here with my medicine in it. And as I go in, I'm going to pinch an inch. I'm going to go straight in 90 degrees, administer the medicine, let go as I come out, and flip my safety cap, and dispose of that in the sharps. All done with the heparin injection. I'll clean up here real quick. Put that in the trash. Got no needles there, so we're good. Next, I'm going to give my vitamin B12. So I will get rid of that one. I'll get my new one out, new supplies out, put my other stuff away. Open my syringe, put my blunt tip needle on. New alcohol swab. Clean my vial of my vitamin B12. Vitamin B12 comes in 1,000 micrograms per milliliter. Check my chart here. I'm going to administer vitamin B12 1,000 milligrams. So easy enough. I'm going to give 1 milliliter. Allow my vial to dry. Take off my safety cap here. Sorry, leave that on for a second. Scoop my cap. I'm going to draw back 1 liter of air. I'm sorry, 1 milliliter of air, not 1 liter. 1 milliliter of air to put into the vial first. So I will take my safety cap off now. Put 1 milliliter in. Draw back my 1 milliliter. And this is my vitamin B12. There. Take that out. Scoop my cap. Check for air bubbles. Everything seems good there. Change my caps here. Take my blunt tip needle off. Get my correct needle for my intramuscular injection, which again, I'm going to find my acromion process. Go 2 fingers down from that on the right shoulder of my patient. Once I find that, new alcohol swab, clean the site off of the patient, 15 seconds, allow that to dry, do not wave it, do not blow on it. Good to go here. I'm going to take my cap off my needle, and with this one, we want to actually spread the skin, make it a little tighter, and this is a larger, full-grown adult male, so I'm going to go in directly at 90 degrees, spreading the skin. I will do the injection, and then as I'm coming out with the injection, I will release that tautness of the skin. Injection's in. I will go ahead and administer the safety cap here and throw that in the sharps. Injections are all done. I will move on to throw this all out. There, and then lastly, we just need to hook up our IVs. So I'm going to go ahead and just get everything open here. A few things to toss out. This I'll need to hang up. Here. I'm going to clamp all my clamps as I'm opening my supplies here. This I do not need. Garbage. This I would have put in the sharps container. Not to needle. Christmas supplies. All right, and those can all stay on. sure my clamps are on. Just one, there's another one. Clamps on there. Alright, so now I can hang some of this stuff up. Obviously, just want to make sure none of this touches the floor. Keep it all there. Okay. How much time am I at?
15.
Okay. Good to go. Continuing opening up my supplies, getting everything prepared here for the IVs. More trash, get rid of that. Alright, so I have too many bags here. I only need one bag of normal saline and one of my Kevzol, 500 milligrams, 75 milliliters. Kevzol, normal saline there. I'll go ahead and prime my bags. So my primary bag is my normal saline. I'll go ahead and get that one ready first. I have my things clamped here. So I'm gonna go ahead and spike the bag. I will take my cap off. Of the bag, take my cap off over here. Oh, I'm sorry, not that one. Take this cap off. And then spike the bag. I'm gonna push it in pretty hard, twisting as I go in. That again is my primary normal saline. There we go. Go ahead and hang my normal saline. Now this is my bigger bag. This is going to be hung lower than my than my actual medicine. Good to go there. I'll finish priming this one. Get that about halfway full. I would normally do this over the trash can. I do not currently have one here. Look up here just to be sure. I don't want to actually let any leak out the end here, so I'll be very careful as I unclamp. Solution starts to come down. There it goes, and I'm watching it. And I just want to get this to the very end without any air bubbles in it. And get it through the other clamp here. Move slow, slow. Oh, there it goes. Three more tubes. There we go. Coming to the end. And we're at the very tip. Okay. That one is primed. Moving on to my secondary. I'm gonna get rid of one of these. I only need one. Secondary here. Go ahead and do the same. Prime this one. Take my caps off. Twisting in, pushing in pretty hard. That one's good. Go ahead and hang this one higher than my primary. I'm going to prime this one, being very extra careful with this one not to lose any solution since this is our medication as I'm priming it. So again, just watching it very carefully as we're coming to the end here. Slow down. Make sure not to lose any. And we're right there. Okay. That one. Now we have both sets primed. Now we actually need to hook them both together before we would then hook them into the patient. So let's stay there. There's 2 ports on here. I know my clamps are clamped. And I'm going to go ahead and use the top port here. And actually, before I take that off, just to be safe, since this one is exposed, I'm gonna go ahead and just wipe that tip off. Allow that to dry. Take my cap off. Go ahead and hook those in together. Before unclamping anything, then we're all set to hook it up to the patient. Before I do hook anything to the patient though, on his current IV site here, I'm gonna go ahead and look at the where it's actually going into his arm. Look for any swelling, redness, tenderness, make sure he's not in any pain. Make sure the dressing is clean, not soiled, dry. Everything looks safe, everything looks good to go there. He's not complaining. So we're gonna go ahead and hook everything up here. Again, just to be safe, one more alcohol swab. I'll wipe our tip off here. Allow that to dry. This one has a cap on it, so we're good there. Go ahead and hook those in together. And then I would double check everything's good to go, and then I would unclamp so the medicine could be administered to the patient. I'm not going to do that right now because I don't know if it'd go into him or not. Everything's been administered to the patient. Cleaned up all my supplies here in the room as I went. I would continue checking with the patient, make sure he's not experiencing any abnormal side effects or any of the side effects from the medications. I'd explain to him that I would simply be around every 15 minutes or so checking as the fluids are being, medication and fluids are being administered. Again, that takes about 30 minutes for that administration of that medication, so I'd continue checking with the patient throughout that. I would then go through my post-procedural steps. I would return the patient's bed to the lowest possible setting, making sure at least 2 side rails are up, so I'd put the other side rail up here on the bed for the patient, making sure he's safe. Bed is locked, lowest position, call light within reach of the patient so he can call if he needs anything. I would assess for any further needs. Again, I'd tell the patient that I'd be back around every 15 minutes or so checking on him. He said he didn't need anything else right now, so we're good there. I would dispose of my PPE, so I'd take my gloves off. I would wash any equipment that I used, any equipment that I use that is not disposable. I would document everything. I'd wash my hands after I disposed of my PPE, wash my equipment, wash my hands, and then I would document everything that went on with the patient, administer of the meds, his reactions, and continue to monitor and document as time